Hello everybody and welcome back to Eye Opener. This is Dr. Mridula V. Amarnath here. So today I thought I'll discuss something about eye floaters. So now these eye floaters appear as small black spots that keep drifting through your field of vision. Sometimes they stand out, mostly when you look at something which is really bright, or say when you're looking at the blue sky, or say when a white paper. Most of the time they tend to annoy you, but generally most of them don't interfere with your vision. So why is it called floaters? That's because they keep moving around in your eyes. Now they come in different shapes. Some of them might see it as black or grey dots. For some it might appear as curved swirly lines, or for some it might be like some few thread-like strands or cobwebs, or maybe in the form of a ring. But once you get them, they usually don't go away. But usually, you tend to notice them less over a period of time. You gradually get used to it. So how does this happen? So you must know that at the back of your eye, there is a jelly-like substance which is called as the vitreous. Fine. So as you age, the protein fibers that make up this vitreous slowly starts shrinking and they start shedding out. And some of them might just clump up together, and the shadow that they cast on your retina is what we see as floaters. Now these changes can happen at any age, okay, but generally they occur between 50 to 75 years of age. It's also more common among those who are nearsighted and also those who have undergone a cataract surgery. It's rare, but sometimes you can also see floaters if you've had a chronic eye disease or an eye injury. Even in those who have diabetic retinopathy or even eye tumors. Fine. Now there are certain serious eye disorders wherein you can see floaters, like when you have a detached retina, or when the retina is torn, or certain inflammatory conditions of the vitreous which is caused by certain infections or any autoimmune conditions, or like I said previously, said an eye tumor. Now all of this can again cause symptoms of floaters. So when do you see a doctor? Now if you have only a few floaters that don't change over a period of time, then I would say don't worry. Okay, nothing has to be done. But you will have to immediately consult an ophthalmologist if you feel that there is a sudden increase in the number of floaters. Now apart from increase in the number of floaters, you also get flashes of light. Okay, there is also a partial loss of your peripheral vision or general blurring of your vision. Or if you've noticed floaters after an eye surgery or an eye trauma, or sometimes if you have floaters along with an eye pain, then do not neglect. Immediately rush to an ophthalmologist, preferably a doctor who also evaluates and understands the retina really well. Okay, point is, if you don't get the treatment right away, it can really hamper and cause a potential loss of vision. So how are floaters generally treated? Now the benign ones, that is the ones that do not harm you or where you don't see a drastic change in their number and size, generally do not require any medical treatment. But if they annoy you, try and get rid of them out of your field of vision. What you could do is constantly move your eyes, probably up and down would be more effective. So in this way, there is a shift in the fluid. But if you feel that they are constantly blocking your vision, they're constantly annoying you and completely hampering your day-to-day activities, then probably you will have to meet an ophthalmologist and he would suggest for a surgery, which is called as the vitrectomy, when he will remove the vitreous and replace it with a salt solution. So my advice for you right now is, if it is very few, doesn't cause any harm to you, you will get over it during the period of time. But if you think that they are increasing and hampering your vision, do not neglect, do not delay, immediately consult your ophthalmologist because there could be an underlying pathology and you don't want to lose your vision. So you immediately rush to an ophthalmologist and get it evaluated. Fine? Thank you and stay safe.